name's Milt Bedingfield. I'm a certified diabetes educator and exercise physiologist. And I've been teaching in the field of diabetes about 17 years. And what I want to talk about for a few minutes is how you diagnose diabetes. One of the concepts, or one of the things I hear about a lot is, well, I'm just borderline. I don't really have diabetes, I'm just borderline. And that's really quite dangerous when I hear that word. Let me explain this a little bit. Diagnosis of diabetes. It's really pretty simple to diagnose. Years ago, the doctor may have done a whole series of tests to determine if you were diabetic. Not anymore, it doesn't take that much. A fasting blood sugar, I'll put fasting, BS, should be less than 100. That's considered normal. No matter what you had to eat the night before, whether it was only a little bit or whether it's a whole half gallon of chocolate ice cream, if it's been about 8 hours since you've eaten, you should wake up with a blood sugar less than 100. Some patients rationalize and they get their blood work back and it's above 100, and then the doctor says you have diabetes or pre-diabetes, and the patient obviously doesn't want to hear this, and they're driving back home thinking, I know why my blood sugar level is high. I went to a birthday party last night and had cupcakes. No wonder it's high. I better tell the doctor that. Doesn't make any difference. You could have a dozen cupcakes. I could have a dozen cupcakes. But if I don't have diabetes, my blood sugar will still be less than 100 the next morning. So normal is less than 100. Let's say you have a fasting blood sugar greater than 100, but less than 126. Well, that's not normal, but it's not diabetes either. That's what we call impaired fasting glucose. Impaired fasting glucose. Now in the past, many healthcare workers have called this borderline, but we really don't like to use that word borderline, because frequently the patient is told they're borderline and they're thinking, well, does that mean my blood sugars are high sometimes and not others, or just a little bit high, or I might be on the verge of catching diabetes, or what? It's not an official term, and it's best we not use that term. So we won't use that term borderline. We're going to call it impaired fasting glucose. Now, or pre-diabetes. That's the term most people are hearing now is pre-diabetes. There's 57 million people with pre-diabetes. 57 million people with pre-diabetes. And unfortunately, a lot of them are going to end up with diabetes because many of them don't know they're pre-diabetic. And many of them, once they find out they do have pre-diabetes, aren't likely to do the kind of things they need to do to prevent their diabetes. We now know that when you have pre-diabetes, if you make some major lifestyle changes, soon you may end up with normal blood sugars again and never actually develop diabetes. But you have to make these lifestyle changes soon after you're told you're pre-diabetic. If you've been pre-diabetic for 6 months or a year, it's very likely too late. In the case of a fasting blood sugar greater than 126 on 2 consecutive occasions, you have diabetes. A fasting blood sugar greater than 126 on 2 occasions, you have diabetes. You might go home not happy with this news. Start eating better for the next week and a half. Throw out your ice cream, throw out your cookies. Stop eating so much pasta. Your blood sugars come right back down to below 100. So you think the doctor's made a mistake. You don't really have diabetes. Or that it's gone away. No, neither one of those situations. What you're doing is controlling your diabetes with diet, which is what some people can do. But as soon as you start getting careless with your eating, your blood sugars will be up higher, and again, it will prove that you do have diabetes. So again, fasting blood sugars, which means you haven't had anything to eat for about 8 hours or more, should be less than 100. Pre-diabetes is when your blood sugar is between 100 and 126. That's also known as impaired fasting glucose. And diabetes is when your blood sugar is greater than 126 on 2 occasions. Once you've been diagnosed with diabetes, you're likely to have diabetes, or you will have diabetes forever. But this hopefully will make it more clear as to how you diagnose diabetes. In some cases, doctors will do one more test or two. to confirm whether it's type 1 or type 2 diabetes, but usually this is all the doctor has to do to determine if you have diabetes or not. I hope this helps.